Why did you come to this health summit? What about this attracted you?
Well, the World Economic Forum in so many things is clearly influential in shaping the way we attempt to address global problems. Healthcare is one of the biggest, and mobile health in particular now has the opportunity to not only transform the way we practice medicine in the United States and other developed countries, but it is a remarkable tool for starting to redress the big difference in healthcare that people in the developing nations don't have access to.
And did you have any set of expectations you were hoping to see at this particular summit?
I think anytime you have a chance to come to a meeting where a lot of people thinking deeply about problems, you always learn. I think that's the highest compliment you can give to any person or to a meeting, and this meeting has fulfilled that expectation. A lot of very bright, smart people thinking about complex problems.
And looking at those complex problems in mobile health, are there some new takeaways? Are there some new things that came out that are making you rethink something?
I don't think there's any profound conceptual or technological changes, but there's always a subtlety each time you get exposed to different people who are dealing with a different problem. So, for example, very elegant example of how do people in developing countries ensure the medicine they're buying is authentic, because counterfeit medicines are a big problem in the third world, and the ability to use your mobile phone just to send in a code number to find out whether the medicine is authentic is a great innovation, particularly in some nations. As much as 1/3 of all the medicines are fraudulent, and when you're dealing with diseases like malaria, that's a tragedy.
In the last session, one of the questions that came out was, is there anything we're not talking about that we should be as part of this space? Is there anything that comes to mind?
There's probably a lot. The first is no one really wants to talk too much about the massive inefficiencies which are embedded in medicine, and the fee-for-service system, even though it's the one that adds the greatest amount of cost to our healthcare system, wasn't even addressed as part of the recent healthcare reform bill, even though many elements of the President's bill are very laudable. But we're not going to control healthcare costs until we get to grips with the massive inefficiencies that come from the fragmented healthcare system that we have. It's what I call the ologist problem. The cardiologist, the nephrologist, the gastroenterologist, and each of them sees you separately.
So that problem definitely happens quite often in the developed world. Do we see the same challenges in the developing world? And in essence, are these really global solutions, or are we looking at a lot of local solutions?
I think we have to look at a lot of local solutions, and that includes the United States and the European nations as having their own local nuanced needs as well. There are certain things that can be extrapolated, certainly amongst the technologically sophisticated nations of the G8 and the OECD. For the 139 nations that make up the developing world, although clearly one does focus health on the level of the individual, for those societies the challenge is much more global public health. How do I control major infectious and parasitic diseases that fortunately we're spared from here in the West?